This week, a proposed budget revealed in Multnomah County, and it turns out the nurse-family partnership could be cut.
And tonight, we are also hearing from a Multnomah County nurse who is a part of that program. Joey Vaca joins us live tonight. And what is this program, Joey?
Liz, Todd, this really aims to help people in vulnerable populations through a pregnancy. Low income, people facing housing security. Someone's paired up with a nurse who will visit them at their home through that pregnancy and then actually for the first 2 years of the baby's life. So the people working in the program are shocked to see that it could be eliminated, calling it essential.
I've seen that, done by
this type of program is exactly the type of thing we need to be investing in right now, not getting rid of.
Hannah Snyder says she's gutted to learn the nurse-family partnership program she works in could be eliminated under the proposed Multnomah County budget. County Chair Jessica Vega Peterson says the budget was designed to prioritize services most important to people who need to rely on the county. But Snyder says that's exactly what nurse-family partnership is, and she doesn't know why it'd be cut.
It helps to work with people who not only are facing that major transition into parenthood that everybody finds to be difficult, but they have a lot of other barriers facing them.
When talking to media yesterday, Vega Peterson said she knows a lot of people probably won't be happy with the proposal.
There were cuts to programs that have an impact in areas of service that we know are important, whether it is health-related programs or human services-related programs. This is the reality when we have a budget, when we have budget deficits.
Snyder says this program actually helps save money. A University of Utah study on NFP in Oregon shows every dollar invested saves over $6 in future costs for those vulnerable populations. And Snyder says emergency care visits, prisons, and jails are all expensive things for our community, but NFP can reduce those costs down the road.
I think that people are really able to transform their own lives with just a little bit of extra support and with a nice trusting relationship that happens over the long term. And so the prevention that can happen before a child is born and in those first 2 years of life, it can really shape the whole lifetime of that family.
We still have 7 weeks until the board is voting on this budget. So in that time, Snyder says they're trying to bring a lot of attention to this issue and their program. They'll be putting out petitions. They'll be going to these county commission hearings, trying to let people know what's at stake for them. Now, I asked, does she think they'll be able to save their program? She says they faced cuts in the past, but she acknowledges that this time with the budget, things are looking pretty difficult. Live in Southeast Portland, Joey Vaca, KOIN 6 News.
Thank you, Joey.